Right, good morning, folks, and welcome to the Health and Wellbeing Board on this lovely sunny day, she would like to say, but can't possibly do that. Have we had any apologies, Elliot?
Thank you, Chair. Apologies from Chris Morley, NHS Devon. Ed Garvey is deputising today. Apologies from Rob Fern, University of Plymouth. Laura Alexander joins us today. Apologies from Rachel O'Connor, University Hospitals Plymouth. Neil MacDonald joins us today. Apologies from Matt Garrett and Michelle Thomas, Livewell Southwest.
Thank you very much. Right, I think what we'll do is I've got a little bit of a spiel to read out. Before we start these proceedings, may I bring your attention to some housekeeping matters. There is no expected fire alarm testing today. Therefore, if the fire alarm sounds, please follow the fire and emergency procedure that are applicable for the council house, which is basically getting outside and going near the court building. This meeting will be broadcast live to the internet and will be capable of subsequent repeated viewing. By entering the Warspite room and during the course of the meeting, committee members are consenting to being filmed and to the use of those recordings for webcasting. Please can I ask that you speak clearly and directly into your microphone when addressing the meeting so that online participants and the public can hear, and that it's switched off when you are not using it. And the usual one, your mobile devices should be turned to silent. I'm going to go around the room and introduce everybody, or let them introduce themselves. Karen, I'm going to start with you.
My name is Karen. Oh, sorry. That one? Yeah. My name is Karen. I work for Plymouth Octopus. That's the VCSE umbrella organisation in Plymouth. Apologies for barging through the door.
Morning all, Councillor Patrick Nicholson, represent the Plymouth and St Mary ward and lead the independents on the council.
I'm Councillor Jemima Lang, I'm Deputy Leader of the Council and I have the Children's Social Care, Culture and Comms portfolios, and I'm a Stoke Ward Councillor.
Good morning, it's Gary Warbridge, Social Strategic Director for Plymouth City Council, Adults, Health and Communities portfolio.
Morning everyone, Ed Garvey, Head of Locality Commissioning, here on behalf of NHS Devon.
Good morning, Tony Gravitz, Manager Health Watch Plymouth and Systems and Intel Lead for Health Watch Devon, Plymouth and Torbay.
Morning, Neil MacDonald, Chief Executive of University Hospitals Plymouth.
Hi, apologies for being late. Laura Alexander here representing University of Plymouth, Bob Fern. The seat down there, okay.
Good morning, Elliot Werngle, Democratic Advisor to the Health and Wellbeing Board.
Good morning everyone, Steve Madden, Director of Public Health.
Good morning everyone, Councillor Andy Lugger, Vice Chair of this board.
And I'm Mary Aspinall, I'm Chair of this committee. David Hady snuck in there, so...
I would have snuck in even more quietly when the door bangs. So good morning everyone, David Haley, I'm the Director of Children's Services.
And Rob, do you want to say hello? Rob, we've got you frozen at the moment, so I'm not too sure what's happening there. He's Rob Smith, and he's the Chief Executive of Improving Lives Plymouth. Hopefully, he'll realise and get himself sorted. Right, okay, folks. Right, declarations of interest. Anybody got any declarations of interest? No. Okay, thank you. Chair's urgent business. Well, I did have a little bit of Chair's urgent business, but the person presenting it hasn't arrived, so we'll fit that in later. All right. That was who you were trying to take up their identity, Michael Whitcomb. I thought, oh, what's he said to you? So, the minutes. Can we confirm the minutes of the last meeting, please, folks? Is everybody happy with them? No faux pas? So, okay, You're happy that I sign them? Thank you very much. Questions from members of the public? I have none. So that moves us on to item 6, which is the Director of Public Health's annual report, the health and well-being of women in Plymouth. Steve, over to you.
Thank you very much, Chair. So before I provide an overview of the report which you received as part of your packs, if I can just ask you to bear in mind the recommendations associated with the report, which is to note the content of the Director of Public Health annual report, to consider the final reflections and how they can be supported by your organisations, to acknowledge the contribution from women in the city and organisations who support them, and also to commit to considering what more can be done to improve the health and well-being of women and girls across the city. So I haven't provided a PowerPoint to you this morning, and you do have the report in your pack, but just to provide you a bit of an overview, it is really a great opportunity to be able to present to you today my annual report. So it is a duty of the Director of Public Health to produce an annual report. The history behind that goes back 177 years. I know I don't look that old. And this is only my 5th annual report, but my first for Plymouth, which makes it incredibly exciting to be able to present this. And this year we decided to focus on the health and well-being of women and girls in our city. So from the report, the evidence is clear that whilst women in Plymouth live longer than men, they spend significantly more of those years in poor health. So healthy life expectancy for women in the city is 55.7 years, which is nearly 6 years below the England average. The average life expectancy for women is well into its 80s, but that then suggests that women in the city are living for roughly about 26, 27 years in relatively poor health. This is not just a health issue, it's a matter of equity, dignity and opportunity. Behind the numbers in the report are real women, and I would just like to say a huge thank you to the women of Plymouth that contributed their insight into the development of this report. It highlights that women not only juggle work, but they are caregivers, they have to manage their own personal health, and also this means that they often put themselves last. Women who face barriers to access basic healthcare often feel unheard and unsupported, and these challenges are shaped by what we call the wider determinants of health, so income, education, housing, how safe women and girls feel across our city, but also things like how we can access green and blue spaces. I'm really keen to highlight that this isn't a report that just highlights problems and challenges. It is about action and progress. And as a city, we are already doing good work to support women and girls. Some key examples here is through the Thrive Plymouth programme. We have a citywide framework which focuses on healthy body, healthy mind, healthy places and healthy communities. This approach is holistic and trauma-informed and ensures lived experience shapes our decisions as service providers across the city. We have cancer champions working in communities to improve screening and uptake and tackle inequalities, but there's more to be done, as you would see highlighted in the report. Devon Integrated Care Board, so our NHS colleagues have invested in a dedicated menopause pathway, training GPs to provide better support for women during that critical life stage. And local organisations like Improving Lives Plymouth, Trevi and Gifted Women are creating safe spaces and empowering women who may face multiple disadvantage. As I've already mentioned, we are embedding trauma-informed practice across the services that we have across the city and strengthen partnerships to address violence against women and girls. And as we know, it's a national emergency that does affect thousands locally. That being said, challenges for the city still remain. So 1 in 5 women in Plymouth would be considered disabled under the Equality Act. There are 36,000 women that have highlighted that they experience at least one event of harassment each year. HPV vaccination rates amongst girls are below the national average at around 66%, and there is a rising concern that this reduction in rates will contribute in relation to long-term cancer outcomes, so we really need to look to how do we improve those rates. and recognising the impact of economic inequality that still persists. So 80% of women employed in Plymouth earn below the national median salary, and the gender pay gap still remains significant. And we know that access to good education and employment is really significant in maintaining and improving health of our population. So the key things that the report asks for us to focus on next is improving access to healthcare, from contraception to menopause care to cancer screening, to continue to ensure that we create safe public spaces for women, for girls and for all, and how we look at tackling online harm, which is very topical. It's in the news this week. We need to look at how we further address economic inequality and support women into education and employment, and make sure that those settings are supporting women into education and the workplace. And ultimately, it is about taking the insight that we get from the women's voices of the city. So those that have told us about how they struggle to get GP appointments, the fear of walking alone at night across the city, and just the exhaustion of trying to navigate healthcare systems in a timely manner that improves the outcome of their health and well-being. So ultimately, although the report is mine, the sole responsibility for improving health and well-being of women and girls in the city doesn't sit exclusively with me. It is a joint endeavour and not the responsibility of just one organisation. So really, this report is a call to action for us to build a city where every woman and girl can live not only longer, but healthier, safer, more independent and more fulfilling lives. And really, it's a call that every woman and girl in Plymouth can truly thrive. Thank you very much, Mary.
Thank you very much, Steve. A brilliant introduction to this, and I think it's, if you've read the report, there's bound to be something that jumps out at you that you want to sort of look into more. So any thoughts? Karen?
Yeah, just a quick question. There's no community builder for women and girls. There is a men's one. Just wondered if that was an oversight, or if that's covered by the Vogue programme, or if there's a plan to put that into action more.
That's a good question, Karen, because I thought there was. So let me take that away and double check that, because we used our community builders to bring the women's voice through the report. So let me just double check and confirm that for you.
Jemima?
I've got two questions, if that's all right, Chair. The first one was around HPV vaccination. I mean, we've seen the impact of HPV vaccination, and I'm really concerned about their take-up being significantly below the national average. And I suppose my challenge here is to everybody in the room, but also, what best practice is there? What really specific kind of intervention or campaign can we do as a recommendation arising from this report to increase that number and to get it to where it should be? Because we know that if you have that vaccination, you are more or less protected from cervical cancer for the rest of your life. And I'm really concerned that there are young women in this city that are missing out on that protection. So what can we do? So can I make that my first question, and then I can ask my second one? Thanks.
So working with our broader NHS colleagues to deliver the vaccine programme, I think there's a combination of things. One is making it accessible, and through the school vaccination programme is really key in being able to do that. I think there's further work we can do with our primary care colleagues about making sure that any girls that miss the opportunity do get effectively recalled to have that. In line with our broader Protect Plymouth vaccination campaign, which we talked about at the last Health and Wellbeing Board, that campaign was launched at the start of winter, well, it was in autumn, with a primary focus of looking at COVID and flu vaccination uptake, which we will report at next Health and Wellbeing Board. But the broader aims of that campaign is to look at vaccinations across the life course, of which HPV will be a core priority for us. So we will be looking at how do we do that comms piece around understanding why the girls of Plymouth aren't vaccinating, and how we turn that into tangible action to make sure that they are aware of the risk of cancer and how it is preventable.
Before we go on there, Laura, can I bring you into that? Obviously, you're going to get a whole lot of freshers each year, and I just wondered if there's any way that we could help you to get some sort of clinics going or something in the hospital.
I certainly would imagine that our Faculty of Health would be interested, so it's definitely something I can take as an action. I also had in mind the fact that changes in HE will mean that we need to work more closely with FE, and so it could be that we kind of use some of the influence or relationships we have there to see how we might facilitate or make easy or make accessible things to young women who aren't necessarily accessing the university but are accessing further education.
Thank you for that, Laura. That's really, really helpful, because I think what this highlights as part of that Protect Plymouth campaign is when we focus on the Get Ready for School campaign, so that kind of 3 to 4 year old, when we're looking at that Get Ready for University campaign, the primary focus historically has always been on meningitis, and I think we need to make sure that we broaden that to maximise the exposure, particularly around HPV vaccine. So I'm glad you mentioned that, and I think there's probably some joined up work we can do there across the uni and the FE as well. Thank you.
I've got supplementary on this. Is that right? So I think also there's a message around that if you didn't get it in school, you can still get it and still get the benefit. And also I wondered if we could find out if there's anywhere that's got higher than average or doing it really well, and just try to understand what they might be doing differently and what their best practice might be. Because I don't know if we can add recommendations, Chair, but this is a particularly, we've got to sort this and get it to where it needs to be. And I'm really grateful that it's been highlighted in the report.
Well, would you like to put some words together that we can add, when we finish discussing this, we can add into a recommendation there? That'd be great.
I'm looking at Elliot, maybe Elliot can help.
I've got the Vice Chair first, then I'll take Patrick then, and then Laura.
Thank you, Chair. 2 questions. I shan't ask them individually because they're quite straightforward. The first one is, you quoted the harassment figures of women exposed to harassment. Yeah. This is a colossal figure. I mean, it's a high percentage. How is that broken down? Is it domestic, external, workplace type of harassment? So that's the first question, a bit more detail on that. It might be deeper in the report, but I read it and I can't see the answer. The second question is regarding the women's veterans in Plymouth, the listening circle. Now, I've got lots of female veterans in my ward bit. Is this publicised? Because not many of them know about this. We all know about the Covenant. We all know about wider work through the Legion, but I'm unaware of this listening circle, and certainly I haven't seen it published.
So in relation to the harassment one, that came through, I believe, the Plymouth survey, in which there isn't much deeper detail, and it only highlights women that have experienced at least one. And again, harassment is subjective in relation to how an individual feels. But let me take that away as an action, Councillor, and I'll see if there's any deeper detail to it, because it's probably helpful to share, given you've asked the question. The veterans one is really interesting, actually, and where I've been on my journey presenting this report, the veterans one, everybody's honed in on, because I think when people think of veterans naturally, they don't think of women veterans, and they don't think of women serving personnel. So there is further work and exploration to do in that space. As part of that report, there are further conversations that I'm just about to have with the military around this, just again to get a little bit more under the skin of the detail, because you'll see in the report it's quite superficial information, but does highlight a disparity, particularly in female veterans. In relation to the listening circle, I'm not sure it is highly promoted, but let me get the information, and I'm very happy to share that with Health and Wellbeing Board members, and we can look at how we exploit that.
And certainly we can speak to Councillor Murphy, who's I think she's president of the British Legion, isn't she? And in Plymouth, and obviously very active within the Armed Forces Covenant. Do you mind? I'm sorry, I jumped on to somebody else before getting your second question.
I'm happy to wait my turn. Okay.
Okay, so then I've got Patrick.
Thank you very much indeed, Chair, and congratulations, Steve, on your first annual public report. Clearly, this is normally the state of the nation for health across the population of Plymouth, and you know the strategy you've applied this year is quite distinctive. I've not quite seen the approach where you focused on a particular sort of area of health. Having said that, though, the normal public health report does give observers an opportunity to look at all health, and clearly this doesn't address men's health at all. So will you be publishing any up-to-date statistics on population, statistics generally for everyone? Clearly, it's welcome that you focused on a specific area, but I certainly would like to know where we are with health in general, and that includes men, in terms of are we making progress? Because generally, Plymouth's health across men and women has been somewhat behind many other areas of the southwest and the country in general. And I think the totality and the picture of the totality would be very useful. But I commend you on your work on this, and certainly, we do need to drive women's health. But equally, I'd like to know where we are, rather than having a 2-year gap, and you might address it next year, to know what progress, if any, or any backward steps have been encountered by men. And certainly we have problems as much as women have problems, and it would be generally appreciative to know what the total picture is at some stage. Thank you.
Very good question, Councillor.
Just thinking about the harassment figures, I've just quickly gone through the crime figures for PL1 to PL8, and every single PL has violence and sexual crime at the top of the list. So just wanted to flag that.
Thanks, Karen. So, Councillor, yes, so 2 answers to that, really. One is that the overall health of the population, it is unique in relation to the Director of Public Health reports, and they used to be very generic in providing an overview. We've got a little bit more modern now, so we do tend to go down into themes. That being said, the overall state of the nation is detailed through our Joint Strategic Needs Assessment, which comes through the Health and Wellbeing Board. So you can see an overview of the whole population health broken down there. That being said, specifically in relation to men's health, as you may or may not be aware, the government published a men's health strategy this year, and we are just looking to do a relatively light touch report off the back of that to be able to understand what men's health for Plymouth specifically looks like, but not necessarily in the detail of the Director of Public Health annual report, but also to highlight how we are already comparing against the strategy's aims and objectives. So I would suggest that we probably bring that back to a future Health and Wellbeing Board as well, that you won't have to wait 1 to 2 years for.
Thank you very much. Thanks.
Thank you. Laura?
Thank you, Chair. Forgive me because I'm probably taking us around about, but I just wanted to add some supplementary information to support rollout of vaccines, but also messaging around, for instance, veterans. We as the university sit as part of the large anchor collaboration because we're one of the, along with the council, one of the 4 major employers in the city. And so that means that we probably have good reach in terms of communicating with our population. Certainly the Thrive programme is represented in that collaboration, but perhaps we might lean into how we might use those 4 organisations working collaboratively as a lever for messaging as well as hosting certain programmes or interventions. Certainly from a health inequalities or inequalities perspective, I think the collaboration would be very keen to do anything that raises it or decreases inequality for women and girls in the city.
Thank you. I'm just going to go back now to Rob, because I think you've got your IT under control now, Rob, haven't you?
I can hear you now, but I can't open up any documents. Every time I go into the agenda pack link, it just seems to freeze everything up. So I'm blaming that. But I can hear now. Thank you.
You're welcome. I think can you just say who you are and who you're representing? I think that might be helpful.
Yeah, good morning, everyone. Rob Smith, Chief Executive of Improving Lives Plymouth and Chair of the Wellbeing Hub Network.
Thank you very much. Gary, you've got a question.
Thank you, Chair. I just firstly want to say I think this is really helpful to shine a light on women's health and all those things. And I think in your reflections, in the briefing paper, you talk about us considering what we do about that. So I just, for me, wanted to just put a few suggestions up. I think we've got something around NHS neighbourhoods coming up in a little while. And I know for us around the work we would do around all of the commissioning of services we do in this city. And I guess for me, it's trying to make sure that we build a link and a connection from this report into those areas of work to help build and strengthen the work that already goes on. And I don't know if, Steve, if you've got any thoughts about how we make sure that those things are there. And I guess the other thing the report talked about, and I think is really important for me, is how we shout out about the value that women are providing in this city. Because if we're not careful, it can feel like a deficits thing. And actually what we're trying to do is sing to some of the strengths and the value that women provide in this city as well. And that, for me, is a nice lead into how you kind of build on the work you do to enhance the value they give.
Thank you, Gary. I think taking that in reverse, I think absolutely we need to focus on what is strong in the city rather than what's wrong. And I think that the report, we've tried to strike that balance, but I think as we've honed in this morning, there are a lot of things that we need to continue to challenge and take things in a better direction for the women and girls of the city. In relation to how we drive some of these things forward in a strategic perspective, so timely that we need to have a conversation about the strategic priorities for the Health and Wellbeing Board going into the next couple of years. So I think there is something about how do we bring this conversation into that one, and we'll talk a little bit more about that on another agenda item. It's also, I think, worthwhile recognising that the governance around neighbourhood teams will come under Health and Wellbeing Boards as well. So I think there's an opportunity for us to make sure that we're helping to drive some of that agenda, particularly in the priority setting space, along with the local care partnership and other associated strategic drivers. Thanks, Gary.
Thank you. Neil.
Yeah, thanks for the report, Steve. You will get a separate invite to come and present this at the Trust Board, particularly, I suspect, to focus on the benign gynecology stuff. I guess just more of a philosophical point around, do we have a sense of, I mean, there are a couple of ways we can look to tackle health improvement. We can try and do, try and move forward a bit in lots of areas, or we can concentrate on a couple of specific areas where we get biggest health gain for the effort. I was quite struck by the differential smoking rates, and then when you look into the kind of top 3 causes of preventable mortality, they're all smoking related, really. For example, so we've touched on a broad range of kind of parts of the report that are in here, but I just wondered if you had a view as to where we should, or should we all coalesce on one particular area where we can all contribute to what that might be.
Thank you, Neil. So as you've highlighted, as I've highlighted in the report, the access to gynecological support is a real challenge for women in the city, as is trying to access timely GP access. But that is generally a challenge for all of us, I think, at this moment in time. You're absolutely right. I think what the report isn't trying to encourage is a scattergun approach to trying to improve everything at one go for women in particular. When we bring that up to population health level, so taking into consideration women and men, we know that cardiovascular disease is the primary driver of mortality and morbidity in the city. So part of my encouragement, particularly as we look at the broader priorities for the Health and Wellbeing Board, would be to consider looking at that avenue, because again, it does give us an opportunity to target multiple interventions that are leading in one direction to improve the overall health outcomes for the population.
Thank you. I mean, it very clearly gives us some data, and I think it's now prudent with us to look at that data and then see how we can improve life. I mean, to me, it's quite horrendous that women are not going for the cervical smears. You know, so I think we need to think about how do we just explain that it's nothing that horrendous. Once you know, you just get on with it. Let's face it. But it protects at least from that. So there's a whole lot of little things. I say little, but there's things that we could take individually in sort of chunks rather than try and do everything at once. And I think exciting time, really. Anybody else want to ask questions? Jemima? Yeah.
Yeah, so around VORG and exercise, I think there's an intersection. And on Sunday morning, I went to an event called Lift the Curfew, which was organised by a young woman called Charlotte Barrett, who's got a running group called Run Like a Girl. And there were lots of running groups from across the city there. And the Lift the Curfew campaign is part of This Girl Can. And it's about being able to run safely and obviously there's a whole range of issues there. But I think there is a kind of intersection between some of the stuff that comes out of this report around exercise and fitness and health and VORG, and I don't quite know where I'm going with my question, but I just wonder how we, the council, working with our partners, can look at interventions and initiatives to try to make women feel safer in terms of exercising in the city.
Laura, if I bring you in, and then Steve will come back then.
So I'm speaking very much from the perspective of being a woman and having in the past been a runner. Do you think, and forgive me for asking this because it might feel uncomfortable, but do you think there's genuine recognition as to the fact that being born into a female body actually means you feel more at risk through nothing you've done, but just from being born a woman? So going for a run is something that I might consider differently to my male partner. And it's nothing to do with the place we live. It's to do with the fact that ever since I was born, I've been born into a body that puts me in a more vulnerable position, whether it's real or not, in our society. And so the risk is implicit in who we are. And I do wonder my question is, how understood is that implicitly we are unsafe in a way that others aren't, certainly men, I would perceive to have a different level of sense of how safe they are just because of the body they're born into. And of course, it's the same for people of colour as well. So,
thanks for that. Steve,
how do I answer that one, Laura?
Yeah, exactly.
That's like a thesis question.
No pressure.
In like 10 words or less. I'm sure what you're describing is absolutely real and spot on. I am not an expert in gender studies, and I probably imagine there is evidence out there that would suggest that women and girls feel like that, but it's not right and it's not okay. And I think this case, I presented this report to a women's professional group yesterday, and we were having a very similar conversation because some of the conversation goes around ensuring safe, protected spaces for women, which is absolutely valid and absolutely the right thing to do. But what we can't do is go, the world is unsafe, so we'll huddle over here where we feel safe. We do need to ensure there are safe spaces, but in parallel, we need to ensure that every space is safe to tackle exactly the points that you've raised. Is that good enough? And has that addressed your point as well, Councillor Lang? Ish.
Ish. And I think that's an interesting provocation from Laura, but I think, even on Sunday morning, hearing people's experiences, I'm sure for some people there is an element of it kind of just imagined but actually, running around as a woman, I was talking to my daughter, she gets catcalled and, it's just an experience of being out in the world that men, generally speaking, don't experience. And so I guess it's not going to be solved here today, but I really think we need to put our mind to how we make our city safer for women. You talk to men who go out and have a run with their earbuds in, it doesn't even cross their mind that might not be a safe thing to do, and it's not the same for women. So I just wanted to raise it here as part of this report because I do think there's a crossover, and what that looks like going forward, I'm not sure, but I think it's something that we all need to put our mind to.
David, just thinking about sort of schoolgirls, etc. I wonder whether that's something that this bit of it, whether you and Steve can do some sort of presentation to heads and see if we can get some motivation, even from primary school heads. We need to be making sure that women feel safer. And if that's psychological as much as anything else, I think let's start with youngsters.
Just in response, there are some good programmes in schools which are run, and some of those programmes we support. Some of them the schools have developed themselves, but absolutely, I've taken action with Steve to raise the profile. Really, give Steve an opportunity to come and present the annual report to our head teacher and senior leader conference, and then start a conversation with them about how Are there more and different things or better things that we could do in relation to the curriculum and the school experience, indeed, of girls and young women as they're growing up? So happy to take that action.
We could also sneak in the HPV vaccine as well. Thank you. Right, so we've got an extra recommendation to add on there that Jemima put together, or hopefully she's putting together.
Yes, Elliot can
Yeah.
refine it. I do something around the council works with partners to ensure the HPV vaccination take up among Plymouth young women increases to at least the national average, if not higher.
Okay, so if we put that as number 5, that would be useful. So at the moment I've got note the content of the Director of Public Health's annual report, 2, consider the final reflections on how they can be supported, 3, acknowledge the contributions from women in the city and the organisations who support them, and 4, commit to considering what more needs can be done to improve the health and well-being of women and girls in the city. I think probably the 2 encapsulates what you've just said there about consider fight more things. So are we happy with that? Rob?
Thanks, Mary. Just linking into the previous conversation about the feeling of safety, particularly when being in public spaces. I just want to raise a point. It might be addressed in Steve's report, so if I've missed it, please apologies. But particularly in relation to domestic abuse and disclosure to the health services in particular, and the ability of health, whether it be statutory or voluntary sector organisations, to manage disclosure and to support and engage with women in a way in which is far more effective at supporting them earlier on, rather than waiting for, is it 15 occasions before the system actually picks them up and actually starts to intervene. The domestic abuse tender has just been recently awarded to a new partnership in the city. What I'd be really keen to see in that service is their ability to engage with a wider health system, to raise awareness and to raise the competencies of staff within the wider system to be able to deal with and manage and support disclosures of domestic abuse. The whole orientation of domestic abuse has to change to being a public health issue rather than a criminal justice or a victim orientated issue. So I don't know whether that's for broader discussion in this meeting or something to take outside, but I just think it's a really important point.
Yes, Rob, I completely agree. Domestic abuse and violence absolutely fits into that public health narrative, particularly from the frameworks we can use to tackle that. I'm very happy to take that as an action because I think it feeds very much into the community connections work. So I can lead through Matt Garrett in that space. Yeah, not a problem. Thank you for raising it.
Thank you, Steve.
Patrick?
Just a very quick point. Would it be worth, Steve, you sharing this with Youth Parliament? Because ultimately, a lot of the youngsters who may have had decisions taken, certainly in terms of vaccination when they're younger by their parents, there must come a time when they actually can make their own decision. So I think spreading in and sharing this very, very valuable findings would be useful with them. I recommend it.
Yeah, no problem. I know it's a heavy read, so we can create a version that's more relevant to Youth Parliament, but can absolutely do that, no problem. Thank you for raising, Councillor.
Right, okay, so can I have agreement on the recommendations that we carry forward? And thank you very much. Yes, because you have them vote on it, yeah. Thank you very much. Anything else you need from us, Elliot, on this?
Just for clarification on that last recommendation from Councillor Lang, instead of recommending that council, I would direct that to either the Director of Public Health or the board. The proposed one that I've come up with, just tweaked, is recommends that the Director of Public Health collaborates with city partners to ensure the HPV vaccine uptake amongst young women increases to national average levels and brings an action plan briefing or options appraisal to be discussed with you to a future Health and Wellbeing Board meeting.
Right, thank you for that. And Steve, thank you for putting that together. I mean, although there's a lot of technicalities in it, I find it still an easy read. And I think that's what you want, isn't it? You just don't want it sitting on a shelf somewhere. So that's brilliant. Okay, right. So we move on to Public Health Intelligence, IMD 2025. Can I welcome our two colleagues to the table? Ruth?
Almost.
Yeah. Right. Once Amanda's settled, do you want to introduce yourself? Ruth will ask you to introduce yourself, and then Amanda as well to introduce herself. And sorry?
It's Ellie.
Ellie. Oh, it's not Amanda. Right. No, that's Amanda Lumley.
Amanda's
I
next.
can't see. Yes, that's it. You haven't got a tag yet. Oh, well, that needs altering. Welcome, Ellie.
Yes, thank you. Thank you very much. I am just going to join the meeting so that I can share our slides. And while I'm trying to multitask, let me introduce, as you say, my colleague Ellie. Ellie Pullen is a senior apprenticeship with us, undertaking apprenticeship around analytical work around health and all of its wider wellbeing, social care, etc. So, I'm struggling a little bit to join the meeting. Apologies. I will be there in a second. There we go. Join. It's always the technology, isn't it? Okay. Join now. There. So I will.
Oh, I'm going to show from two angles.
That's okay. No, I'm going to share the slides. Right. Lovely. Thank you very much. So, I don't know why, there we go. So the index of multiple deprivation is something that you will hear us talk about a lot. And main reason for that is because many of the health and wellbeing indicators that we look at across the city are related very closely to the index of multiple deprivation. So many of the things that you will see, the maps of the city that you will see, things like, for example, childhood obesity maps very closely onto the index of multiple deprivation. That index gets reviewed regularly. A lot of the time, we do some work in the background to understand exactly what that looks like, whether there are any changes for the city, whether there's anything we need to bring to your attention. Most of the time, there really isn't a great deal to bring to your attention. Our relative position stays pretty much the same compared to other cities and other local authorities within the country. This year has been slightly different, and so Ellie has done some additional work to understand what it means to us. So we're just going to take you through a little bit of technical detail first, and then we'll get to the key messages that we want to leave you with. I'm clicking, there we go. Okay, wheels.
As Ruth said, I think it is important to understand kind of what underpins this index of multiple deprivation and how it represents deprivation as a whole. I won't bore you with all the indicators, but IMD is made up of 7 weighted domains. They're all weighted a little bit differently. And they're also all made up of specific indicators. So, for example, income looks at the amount of people on means tested benefits, so universal credit and things like that. Employment looks at people who are involuntarily excluded from the labour market, while education looks at quite a few things. So you're looking at Key Stage 2 and Key Stage 4 attainment, rates of entry to higher education, persistent school absences. This is something that was added following kind of the pandemic and things like that, as we saw a rise in that, and adults with low and no qualifications. Health looks at a kind of broad spectrum of things. We're looking at illness to disability ratios, years of life lost to disability, hospital admissions, suicide and other aspects of PIP and disability benefits. Crime, again, looked at personal and material victimisation. Barriers to housing and services looked at the physical and the financial aspects to housing. And I think we've got living environment, which looks at housing quality and local environmental conditions, so EPC, air quality and road traffic accidents. It's really important to consider the fact that these domains have been altered since 2019. So when we look onto the data,
it isn't directly comparable. You know, these have changed significantly since the IMD kind of started. And I think it is important when we're looking at, oh, our living scores have improved massively. They have improved, but these indicators have also changed. If we go to the next slide. So Plymouth has seen massive improvements. So in 2019, we were 64th out of 317, where 1 is the most deprived. And in 2025, we are 87th out of the 296, I think. So that is a significant improvement, but there is also notable changes in the number of the local authority districts throughout the years as well. Our highest ranking domain has been consistent throughout 2019 and 2025, which is the barriers to housing, while our most improved is living environment. This has significantly improved, but it's also important to consider that changes have been impacted by these changing indicators. So there's been a lowered importance of houses having outdoor private space. So it used to be considered a lot more important that people have access to these private gardens, and this is no longer as important, and your indoor environment now takes up 70% of this indicator. The indoor environment also no longer looks at access to central heating, as we're seeing most houses now have access to central heating. It's now just looking at the EPC rating of houses, which I think potentially overlooks and that's quite important. You know, you might have a brilliant EPC rating, but it doesn't mean you can afford to put the heating on when you've got an ancient radiator. If we go on to the next slide. So the most deprived LSOA is in St Peter's on the waterfront. This has dropped 75 places over 6 years. It's also within the 0.2% most deprived in England and has remained in the 1% most deprived for 10 years. The population is 1,843 and makes up 0.7% of Plymouth's population. While the least deprived is in Plymstock Dunstone, the least deprived LSOA has remained in Plymstock Dunstone for the last 10 years. When we're kind of looking at these, we're looking at an LSOA which is in the 1% most deprived and an LSOA which is in the 5% least deprived within a 20-minute journey from each other, which I guess represents kind of the broad spectrum of deprivation we see within the city. When looking at the LSOAs in depth, 11.7% of the LSOAs are in the most deprived 10%. They have the combined population of 32,000, which is 12.1% of the population. The percentage has decreased since 2019, where we had 17.4% of LSOAs in the most deprived 10%. There are 6 LSOAs within the most deprived 5% and 42 LSOAs within the most deprived 20%. These are really important because they really could slip into the 10% most deprived, or I mean they could increase into kind of the 30% most deprived. If we go on to the next slide. I guess it's kind of important to look at Plymouth within national context. Everyone kind of cares what we look like compared to everyone else. Plymouth sits within the key cities, and half of the similar kind of urban cities have gone up in ranks and half have gone down, with Plymouth making one of the most significant improvements out of the 20 cities. Not mentioned on the slides, but also part of the Sagoma group. They represent 50 urban authorities, and 18 have become more deprived and 27 least deprived. We've become least deprived, and the biggest improvements are seen in similar cities such as Leeds, Warrington, St Helens, and Plymouth is the final one of those.
So this sounds on the face of it as if it's positive news that deprivation in general has reduced, at least the index has reduced. But what we want to do is kind of ground that in poverty. What is the levels of poverty in the city? Are we seeing improvements in that as well? Because we know that is a very, strongly related to many of the health indicators. And unfortunately, the answer is no. So I didn't want you to go away from this conversation thinking, oh, great, everything's rosy. It isn't. So I've put in the pack, I won't go through these in detail, but I've put in the pack the rate of absolute poverty. So this is children living in low-income families in Plymouth, which is the teal colour, compared to the UK, which is the pink colour. And you can see that our rates are higher than England. And you can also see that the rates have grown over the last few years. So that one is absolute. The next slide, which is also in the pack, looks very similar, and that is relative poverty. So there are different definitions to those. Both are talking about whether you have sufficient money to cope with the costs of generally of living. So I don't want you to go away thinking that everything is, is great. It's positive news that we are seeing some improvements in the index of multiple deprivation, but we need to keep that grounding that we still have significant rates of poverty across the city and in the pattern that we are used to seeing. And it's also no surprise to you if you look by ward that this does correlate very well to the index of multiple deprivation, that the wards with the highest levels of poverty are the ones that you would expect to see. And we talked about St Peter and the waterfront having one of the most materially deprived lower super output areas in the country, and that's reflected in this as well. So I'm going to stop there. In your pack, there are a few more slides just for your interest, some of which are just highlighting some of the other reports that have come out from the Public Health Intelligence team in recent months, and the links are there if you did wish to know more about them, or do drop me a line if you wanted to talk through anything. Thank you.
Ruth, Nellie, thank you very much for this. It makes it hits home, doesn't it, when you see these facts? And we still know we've got a lot of work to do. Any questions for the team? You've stunned them. Yeah, Andy?
Just because I'm a bit of a geek, you say the methodology was tweaked or changed. Is there a compelling reason why it was changed?
So things like universal credit, the massive rollout of universal credit since 2019, that was kind of a big factor for that, especially with income. There obviously is reasons behind their methodology, and they've got a technical report, which is, if you're a bit of a geek, is really interesting to read. And they do have their reasons behind it, and it has changed every single time, but it's just something that we kind of take into account when we see these massive improvements, that it does have to be considered.
I think what I would like to find out is, how do we get the rest of the councillors to understand what's happening in their wards? So I think if I can get you and Steve to do a thinking job as to how we can do it. I think probably we're all well aware of our own wards, but it then shows it in comparison to the wards. So we'll have a talk about that. I've got Gary, then I've got Neil.
Thanks, Rick, and thanks for the report, and Ellie for coming and delivering it. I guess I'm sat here feeling a little confused about our message in this space. So the way we count this has changed, which has improved our position, but it feels like what's happening in our city hasn't improved. And I'm wondering what the message is that we're giving out as a consequence of this report. It's a really significant thing for a city. It's really significant for those communities, the messages we put out, but it drives a lot. So I'm just interested in your thoughts around that.
Yeah, absolutely. So the key messages that we had put in the recommendations here is that I'm asking you to note that the methodological changes make it look as if Plymouth's position has improved. However, there's no evidence that poverty across the city has significantly improved. In fact, there's evidence that the number of children living in poverty has increased. So, it is confusing, I agree. And personally, I hate indexes because they combine so many different variables that it makes it difficult to see what's going on. However, this one is a very useful one to have. And it's also an important one because, as you'll be very aware, many formulas use the index of multiple deprivation to look at things like funding and things like that. So I suppose, there is a concern that this change in IMD makes it look as if our needs in the city are lower when we're not seeing that on the ground. And when you look at some of the individual measures, we're not seeing that on the ground. So yes, that is of concern.
Can I come back? That's really helpful. So I guess my question for this group is, what's our message about this, both for our city but also externally? What is our message here? Because I read most improved around barriers to housing. I think I heard you say that's because we now don't count some things which have just happened to advantage us, I assume, and have disadvantaged other areas. So I think for me, there's a key thing. What is our message about poverty, both for our city, but also, and I'm trying not to get into the funding formula arrangements, but how we advocate this externally. We need to know what our city's like in terms of poverty, and therefore what our actions are to deal with it. And also genuinely where we've managed to improve it or not, that we can shout about those things rather than some of these metrics, because they don't seem to help us.
Thank you. Neil?
Yeah, I was going to sort of make a similar point. I don't think I've got a question, more of just a comment really, that I read this and thought it's quite a positive thing in terms of something must have happened to successfully improve some stuff, and sort of the present. I know you're trying to ground it in reality in terms of it's all comparative, etc. But I just what can we do to pull out what's happened over the last 6 years that actually we have done some stuff that genuinely has led to a measurable improvement in life circumstances for people, and can't quite kind of search for that. So just similar to Gary's point, really, I was just left a bit sort of confused about so what, and what do I then kind of say this to the organisation. The other thing I just obviously note, given I've got a health commissioner sat to my right, is the difference between Plymouth and Exeter, which is interesting.
I think probably the best thing to do there is to reference what Steve mentioned earlier, which is that we are doing the kind of the state of the city report at the moment that will look at each of the different parameters that not specifically, not just the ones that feed into this index, but looking across the breadth of, you know, living and health and well-being across the city. And we hope to have that completed, or at least a draft completed, by the middle of February, which we could then use, and we want to bring to the Health and Wellbeing Board to look at priorities. And you're right, there are some factors that are related to people's health and well-being and their living that have improved. Poverty, particularly children living in poverty, is not one of them, and that is one of the critical factors. So,
Thank you. Rob, with your sort of hat on as being sort of overall working with the hubs and whatever, are these the sort of things that you're picking up, are the concerns that you're picking up from the people that are working with the your clients?
Sorry, my initial response was crikey, big question. The breadth and depth of the work that the hubs are involved in is incredibly broad, and each hub wouldn't necessarily look at this information and align it to its locality. So yeah, I find that a really difficult question to answer on behalf of a wider wellbeing hub network. I think we really need to take it away and look at it within one of our leadership groups and develop a response. Mary?
I think then it would be worthwhile waiting till Ruth and Ellie and Steve have got something more solid to give them. But no, I just wondered if people were coming to you sort of on a regular basis and saying, "Oh, we've had this, that, and the other happening," and whether that fitted in.
We're just in the process of trying to pull together some form of information dashboard for all of the wellbeing hubs, which we're making some decent progress with now. But it's difficult because we've all got different management information systems and we record different data for different purposes. But if we just look at the low income and we look at people accessing our drop-in and walk-in advice service at Ernest English House, this year we think we're on track to support people, and I don't know how you can interpret this, but we've been helping people draw down about £6 million a year in welfare benefits. This year we think we could be nearer 10 million. So I don't know whether that's because we're becoming far more effective at this, and bearing in mind the thresholds and the process for applying is actually becoming more challenging. But we're being more effective at supporting people to actually draw down benefit data. So make make of that what you will at this stage until we've done a deeper dive to understand it. But yeah, I think that's an interesting indicator.
Very impressive amount that you've been able to draw into the city. Right, I have Jemima next, then Karen.
Thank you. People have covered a lot of what I was going to say around the funding, because this is a measure that is used in many formulae around how we get money for the city. And when I read it, I suppose I thought, oh, you know, two things can be true at once, but actually, how can we influence the indicators that go into this? Because your point around child poverty is the really salient one to me. And if there's no improvement there, and in fact it might be worsened, might have worsened, I just wonder how we can you know, because we all want Plymouth to improve, but if we're saying these are not a true reflection of what we're seeing on the ground, then it's not helpful to us. And what power or influence do we have to feed into the people who put these indices together, to say, actually, are you looking at the right things now? And have you thought about including this or excluding that, to give a real picture of what it is actually like on the ground in a place?
Yeah, that's a very good question, and I have to admit that we were not aware that these changes were being made to the methodology until it was published. I don't, you know, it's possible, but I don't think we had missed any opportunity to be involved in any consultation. Although they do give detailed reasons for their thinking as to why they've put them in, any change is disruptive, really, isn't it? Because it, like you were saying, Ellie, you can't compare to previously, and it does mean that it makes it more difficult to compare across cities as well. So, I don't know is the answer to that, I'm afraid, at this stage, but I will be trying to find out, given what we've seen happen. They normally update it every 4 or 5 years, so I don't think there's much scope to have any change, you know, in the short term at least.
Karen, then Laura.
Just a couple of things. So anecdotally with child poverty, obviously the 2-child cap we've seen has had a significant issue for families. I think that's going to change now, so that might shift things forward a little bit. And I think that's possibly why there's a difference in the figures. And then the other thing I was going to say was, based on the comment about how councillors can access this for their own wards. So within the plymouth.gov.uk, you have a whole pile of maps there, 2021, which is great. We use them all the time. I'm just wondering when they might be updated with this next data, because there's usually a bit of a lag, although 2021 is way better than 2014.
Yeah, thank you. And yes, as you say, the child poverty will change as well. It isn't just the indicators. You know, we are living in a you know, a world where things do change, and that should be a significant improvement. Certainly, there were, I can't remember the exact numbers, but there are quite a large number of families in Plymouth that are impacted by that cap. So that being reduced will make a significant improvement. So there is some positive. And in terms of, yeah, we are at the moment updating everything. So we're doing the full Joint Strategic Needs Assessment report, and we will be updating those. And so many of the online tools that we signpost to have already swapped out the IMD as the comparator. So I will double check on that, but I believe that we're now pointing at the sites that would have the updated figures, but some of our work is in progress.
Really good for councillors because they compare to Plymouth. Yeah, so each individual compares to Plymouth. So great thing to signpost councillors do as well.
Thanks, Laura.
Thank you, Chair. It was just a supplementary point to the question around how useful is the data if the parameters are constantly changing. It struck me that that's an academic question, and actually Professor Sheena Astana was probably as the health policy person, and actually how relevant is data in informing funding and policy. She's probably actually the person who could start to answer that question. And if there is a conversation to be had with the people who set the parameters of how the data is set, she'd definitely be the avenue there. And of course, you know her so well.
Yes, thank you. I was going to say that yes, I have been speaking to Sheena about it, and it is a bit of a conundrum. And one of the things that we will want to do is understand whether the new IMD correlates better with some factors. So it may be that there are areas in which the correlation is improved and that it could be helpful. But overall, at the moment, it appears to not be so helpful to us anyway.
David.
I think I've put my hand up and down 3 times because really what I wanted to say has been said, so I won't repeat that, but I would just state, as you know, the Director of Children's Services, the importance of that second recommendation in relation to we are seeing an increase in children in poverty. There is nothing within the work of my service that are suggesting that families and children are being lifted from poverty. So I do think the conversation about the messaging, how we use this, the impact, as Councillor Lang has said, because this is used absolutely directly in terms of resources, grants, money into multi-academy trusts and schools. This is also used as a formula to base that on. So it does have quite a significant impact on our city in relation to what those index of deprivation figures are saying versus what we really do know about our city. And the second thing I wanted to raise, and it's not of a focus for today, I know, but there are a couple of slides in here about the BMI tracking for reception to Year 6 children, and I just didn't want us to lose the impact, I suppose, of those slides, because we can see that we have a significant challenge in relation to the weight of our children and young people. And you know, that salient comment that you've made somewhere in the slide that I've read, which is, you know, the flow is from healthy to unhealthy, not unhealthy to healthy weight. So I think, again, you know, concerted efforts all round really. And if there's anything that I can do with the interface with school communities or with my teams as part of that strategy to further reinforce and to try to have some impact on that, then, you know, clearly perhaps we could have a follow-up conversation, or I could just talk to the lead consultant that's leading on that, just to make sure that there's been a response from the Health and Wellbeing Board in relation to seeing those couple of slides today.
I mean, the one positive thing I would say about that is that the flow from healthy to unhealthy is less in Plymouth than it is in England. So that's one of the areas where we actually do seem to slightly shift the trend. It's been a bit of a, we know there's been a lot of concerted work in schools to make schools healthy places. We can't attribute it exactly to that, but certainly, you know, the children, our children who are coming into reception, who are not of a healthy weight, who are overweight or obese, is higher than the England average, which is what you would expect given our profile. But by the time they are at Year 6 or age 11, we are actually at the England average. Now that isn't good. There are still too many children in that category, but there are some signs that certainly the school environment and the work that's being done with families of that children of that age is doing some good. So thank you.
Thanks very much there. We have a recommendation which says to note the IMD 2025's report, and in particular that the change in deprivation is reflective of a change in methodology rather than a change in poverty in Plymouth. And the reason we want to put that in is there's a risk that focus might be reduced on tackling poor health and reasons that lead to poor health if this is misinterpreted. I think that is essential that we get that right. So are you all happy with that, folks? Right, excellent. Now you probably noticed that a certain person snuck out of the room just now. I gathered that Steve is the strategic director covering for our chief exec, and I guess we could all probably guess where he's actually had to go to really after yesterday's announcement. So Ruth is going to take over seamlessly. Thanks. Right, Amanda, do you want to come up to the table? Amanda is the chief exec of Destination Plymouth, and we felt it was really important to bring the city brand strategy to you so that you know about it. And I'm sure when Amanda said her things, Jemima will no doubt have some contributions to make as well. So thank you. Welcome, Amanda.
Thank you very much, and thanks for the opportunity to bring this here today. So I think we're just going to try and run a presentation for you. If you would like to just give me 2 minutes, I'm just going to try and set it up.
There seems to be a problem with the link for the slides for this on the council's website there. Andy was saying he tried to open it up last night and ended up
On the public one,
yeah.
it didn't open, it crashed, it said it wouldn't download. And I just tried it now again. And
It's not,
it wasn't.
for
Just for this item.
This item, yeah.
Yeah.
All right. Right, the floor is yours, Amanda.
Thank you very much. This is the backdrop to this piece of work. Started about 2 years ago, and the Destination Plymouth Board, which includes Jemima and a number of other key city leaders, recognised that as we head forwards, there's this huge growth trajectory for the city over the next 10 years. And so we were tasked with looking at the city branding and the positioning and thinking about how do we change perceptions of Plymouth as a city going forwards, mainly driven by the requirement to attract people here to live and to work and to study. So I'm just going to take you, I think we've got about 15 minutes, is that right, Mary? Just to go through our sort of journey, really. And I wanted to share it with you because you may have seen, some of you may have seen some of the City of Culture announcements over the last week or so, which have been brilliant, very exciting for the city. And I'm absolutely thrilled to say that Plymouth Culture has already started to use some of the visual assets, but also some of the messaging that we've used. And what we recognised was really, really important to have a clear narrative for our city, something that sets us out, sets us apart, really showcases our point of difference in what is a very, very competitive environment at the moment for many, many sectors and organisations nationally. So we recognise that as a city we are unique. We all know it. We know that we've got some things about our city, which is part of the reason why we all live here and we love it. But we recognised also that actually externally that a lot of people just don't know anything about Plymouth. In fact, at best, people's perceptions of Plymouth are nothing. They have no idea what might be here. And, you know, at worst, they think we're a city that is too far away, we're unconnected, we have no culture. We are just a naval base, and although we love our naval colleagues, we all know we're a bit more than just a naval base, and so on and so forth. So over the course of this project, we decided we needed some really key aims. We needed to attract, change perceptions of the city. We also wanted to really encourage our local community, our young people, and really give them something to be proud about, to really sort of try and raise those aspirations and those ambitions, because we have got a lot of things to be proud about and to shout about. You know, we are like any other city in the UK, as I've been hearing this morning. We have our own challenges across the city, in many different places. But actually, as a city, we are also doing a lot that is really right. And it's really important that we balance out some of the negativity that we hear with some of the really positive things, and encourage our young people and people who are looking at potentially staying and working in the city, that this is a good place. And we also wanted to create a story for our city which was embedded in community truth, something that people could resonate with, something that they recognised and said, yes, that's me. I see that, I recognise that, I can be part of that. Something that people could be really proud to use and to adopt. So we did a piece of perception research nationally. The research covered a number of different elements. In the first instance, it looked at what were external perceptions generally of the city. We also did some specific work around talent attraction and, you know, why do people move? Why do they relocate? And then some even more specific pieces of work linked into our growth sectors, so particularly linked into nuclear defence, health and well-being, so looking at NHS, for example. So we drilled down into lots and lots of different sectors, working with our partners. And the partners working on this project were part of a wider city brand development group, and they did include many of your organisations from in this room. I particularly cite the NHS Trust, but also the university, for example, and many others. And they jointly scoped this piece of work, and they jointly led the process working with us. So some of the things that came out of the research, and this is just headlines, I have shared the research report previously with Cabinet and with scrutiny. I am very happy to share it again if anybody has not seen it, but some of the headlines that came out around some of the really key attributes of the city were, of course, the ocean. It is one of our most recognisable and powerful assets. We have got one of the most fantastic waterfronts in the world. We have actually got the UK's first national marine park and only national marine park. And we have lots of sites of protected scientific interest and so on and so on. So that is one of our assets, and its potential is still to be harnessed, and things like the announcement around the National Centre for Marine Autonomy and various other things demonstrate how that is starting to catalyse. Plymouth's quality of life is greater than other comparator cities. Now, we looked at a number of comparator cities across the UK. So, for example, Southampton, Portsmouth, Bristol, even Norwich, and various other cities. And we looked at some of their metrics linked into health and well-being. So that was things like happiness metrics and things like activity metrics. And what we found was that actually, generally, Plymouth scored much higher than some of those other comparator cities. So that's positive. We know it's still work in progress, but actually that's good. It's a great place to be, so let's be proud of that. Talent is looking for career growth, but our city is absolutely not known for innovation. And through the talent attraction work, what we found was that when people are looking to relocate and move, they're looking for clusters. They're looking for other organisational and clustered ecosystems linked into their piece of work. So if you're in healthcare, you will be looking not just for, when I move there, am I going to like it and is it going to work? But you're going to be looking for, okay, where are my next steps if I'm going to move? So what's the opportunities to progress? Are those next steps within the existing organisation I'm going to move to, or are they within a broader ecosystem? What are the opportunities? And likewise, what are the opportunities for my family? And then what we also pulled out was the fact that we have this growing cultural offer across the city, and the city is absolutely not known for culture. The perceptions of our city for culture are really low. And that's why the City of Culture announcement is so exciting, because if we wanted to put our city on the map for culture, then that's a great way to do it. However, we are, through our creative industries and through the work that we're doing, we are shifting that gradually. It is shifting and it is changing. But that can be a huge catalyst for all sorts of things, because people want to live in a place that's fun, that's exciting, that's got things happening, and all of those different factors. They don't just want to go somewhere which is just, you know, nothing's happening there. So we also found some key themes that came out. Of course, our economic specialisms support national ambitions and national security in a number of different ways, whether it's from defence to autonomy. We have a very friendly and welcoming community generally, and I think many of you will recognise that. We are the same as any other city in that some of our community elements are not how we'd like them to be, but generally we've got a really strong, friendly community. And we also need to show full family support to ease people. If they want to move to the city, we have some amazing organisations, POP being one of them in our city, that can support and welcome people in, so we need to showcase that. We need to connect our young talent with the opportunities in the city. So this was something which was particularly of interest to the educational partners. What's happening is our young people are not seeing Plymouth as somewhere to stay because they actually don't understand what else is on offer in other places. They don't understand what those comparators are. They don't understand, for example, that if they want to work in the NHS in Bristol, or Plymouth, they can probably get the same job with the same pay scale and structure, but actually they can have a better quality of life here, and actually their living costs will be lower. So there are some comparators there which are really useful, which came out. And then our future story is really important, because people also want to go to a place that is demonstrating it is growing and it is thriving, and we have I think an £8 or £9 billion investment pipeline. So that was a theme that came out, which was actually tell people about that, because investment attracts investment. So the more we shout about that, the better. We went through a three-step process, as I've explained. We did initially research. We did the external perception survey, but we also did further research looking at people's perceptions within the city of our existing Britain's Ocean City branding. And based on that, we decided we would retain that, but what we would do is we would evolve it and reimagine it. And we went through a process of community co-creation, can't say the word, working with our local communities to really understand what were the things that were important to them, what did they love about their city, what was really meaningful to them. And we had lots of conversations, I have to say, about Smeaton's Towers and Pasties and Plymouth Argyle and a whole range of other things. But what came out overwhelmingly was actually there's this quiet pride within the city of some of the things that we have, you know, and you know, that sort of was really meaningful. We also, some of the communities were new communities that were coming into the city, some of our global majority communities, and what they said was that they had felt welcomed in, and that was quite heartwarming as we went through that process. And so what we've ended up as the end result of that is a set of new narratives and a whole range of new visuals that we hope we can share and be proud of. So this is our sort of, I guess, our overarching story. Make life an adventure in Plymouth. Between the Dartmoor National Park and the UK's National Marine Park, we are a city wild about nature with the warmth of a strong community. And the nature bit is incredibly important to many, many of the people that we spoke to. That ability to actually just walk outside and go into green spaces or places or connect. And we have planted over, I think, 50,000 trees, is it, Jemima? I think 50,000 trees over the last 5 years, which is pretty significant in terms of how we're trying to protect and nurture our green spaces and environment. We have this mass of opportunities, over 25,000 new opportunities, and we have this innovative business ecosystem which is growing and evolving and is nationally and significantly important. So these are some of the headlines that we've put as I guess starters for 10, and which really highlights our USPs and really showcase some of the city's strength. We have over 500 years of innovation. whether that is Darwin or Ellen MacArthur or, you know, a number of other innovations. You know, Roger Thompson at the university, who's one of the leading scientists in the world on marine microplastics. And this strand runs through, it's part of our heritage. You know, it's a really strong strand from, you know, very, very early on, centuries ago. This thread runs through the city. We are a city wild about nature. We are the only UK city to be between a national park and a national marine park. And some of the work that we're doing in the green and marine spaces is innovative and is really forward thinking. And I think that is really crucial. And I know we've got our new plan for nature led by Councillor Browse-Delve, and that's really exciting in its own right. The horizons are bigger here. So we have over 25,000 job opportunities over the next 10 years. And if you're a person who is wanting to grow your career or a young person who is wanting to stay here, there are lots of opportunities. What we need to do is we need to help our young people understand what those opportunities are and why they should stay, as well as attracting new people in. Creativity knows no bounds in our city. We are a very creative city. We do all sorts of things. In fact, I was reflecting back on some of the film footage that we showed last week with where we threw the hatchling off Plymouth Hoe when we did the Illuminate Light Festival, and that's just one or two examples of some of the creativity. But we have this amazing cultural community and creative community growing. But creativity runs right through our city. It runs through the naval base and the dockyard. People want creative thinkers and problem solvers. They want people who can look at knotty problems and provide solutions. So creativity is not just about art. Creativity is about a mindset and a way of thinking. And then we have this community that goes beyond. So nearly a third of our local community, according to recent census data, are active volunteers, which is fantastic and is a higher stat than many, many other comparator cities. And that's something we should be really proud of. We've got these amazing volunteering organisations, and it's something we should really shout about. And then lastly, we're charting an exciting future. We have this huge transformation happening in our city with over, it says 6 billion there. I think the number keeps going up. It went up to 8 billion and now I think it's gone up to 9 billion. This regeneration pipeline that we have within the city, which is driving homes and jobs and really shaping our city for the future. Alongside this, we tried to explore what sort of values have we got as a city. And when we did the community co-creation sessions, you can imagine we had reams and reams of charts and post-its and various other things, and people saying what they felt they really aligned to. But these were the three things that came out in when we sort of looked at all of the input. One was go boldly. So Plymouth is not, or has never been one to follow the flock. We know that. Historically, the citadel turned its guns on the city, didn't it, in Cromwellian times, because they were rising up and saying, no, we're not doing it that way. So it goes back a long, long time. We do things differently, and we do it first. We have so many firsts in the city. We go together. So we've got this legacy of a naval city, this legacy of supporting each other and helping each other and working as a team. And we go far. Our impact reaches across the globe. We can raise ambitions, and together we can achieve amazing things. So those are the values that sort of came out of our community co-creation. And of course, a personality alongside it. So confident, friendly and adventurous. All of those things came out of the work that we did. So what we've done is we've taken all of those and we've set up a new brand toolkit. It's a virtual toolkit, it's online. And that toolkit has got everything in it that you need. And so that was what the Plymouth Culture team used last week when they created the assets for the City of Culture. You can go onto the toolkit. I do not know if this will work, she says. Probably not, knowing my technology. But if not, it doesn't matter. I think I might have to go onto a different screen to share it. Yes, I might. Yeah, okay. I'll share it at the end then. So we have the toolkit. You can just access that. It has on it all of the narratives, but as well as that, it has a whole range of facts and information. It's a bit like a virtual book of wonder, I should say. If you look on there, you can see all of the facts underpinning all of the different elements of the work that we did. And there are also case studies on there. So where we have organisations in the city who are doing new, leading, innovative things, we've put case studies on there as well. So if you're creating a prospectus or you're creating a document and you want factual information about the city, if you want images, we have a brand new image library which everybody can access. The image library, sorry, I've lost my slide presentation now, apologies. The image library is accessible, and not only has it got some great images in there, but also you can put your own images up there if you want to. So if you want to share your images and everybody can see them, then you can actually link it to that. We can accept them, assuming that they meet the criteria. So my slide presentation's frozen for some reason. I don't understand why, but because I'm not technical enough, it stopped sharing for some reason. It's just frozen. I don't know. Yeah, we'll stop it and start again. Apologies, I'm going to finish off now. Yeah, on to that. Oh no. Oh yeah. I don't. Yeah, I'll have to go that way. Yeah. Apologies, everybody. Technology has beaten me again. Hopefully that will go on to the next slide. There you go. So we have a media hub, and you will have seen already some applications. You will have seen the work around the civic centre. The hoardings look fantastic. If you go onto the electric buses, you'll see that we have some of the messaging in there. You'll have seen we adapted it for Christmas, and you'll see we've been encouraging partners to use it and adapt it in their own way using the toolkit, and that's what Plymouth Culture did last week. So just to finish off, she says, trying to scroll across her screen. We've created this for everybody in the city. This is not, you know, mine or, you know, Jemima's or Elliot's. This is for everybody. We can all use it. So I'd encourage you to cascade through your organisations, through your networks. If you'd like us to come in and present to some of your colleagues in your organisations, then please just ask. We can certainly send out links with access to the brand toolkit and to the media hub. And, you know, my plea to everybody here is there's three things you can help with. So one is talk the talk. So be proud to talk about some of those narratives. Be proud to have conversations with people and you know, really sort of be consistent so we're all saying the same thing, because if we amplify the strengths of the city outwards externally and we all say the same thing, that's really powerful. Share as much as possible, spread the word. If you have local communities that you feel this would be beneficial, we're already in conversations with the education team, for example, with Amanda Davis and her team to talk about, okay, how do we think about embedding this into, you know, the daily life of our young people? How do we embed through our young and early years education to really start to make people aware of some of the good positives that we have in the city? So if you can think about that, that would be really helpful. Come and have a conversation with us, and we'd be happy to do, you know, presentations, adapt, fine-tune, provide information, etc. And then last but not least, you know, please invest in your promoting, you know, your city. Please make sure you are putting energy and resource into doing that. And I know a number of organisations do a significant amount of activity externally to the city, but don't just talk about your own organisation, talk about the city itself, because actually people are attracted to places that are positive and vibrant, and we want to make sure we're sharing those perceptions. So that's it from me. And we have an amazing film, which is our brand film. I don't know if it will, I don't know if it will work. I'll click on it and see what happens and see whether it actually plays or not. It might not because of the size of the file, she says. Yeah, no, I don't know if it's going to play. Oh, there it is. I have to click on that. Oh.
Where the endless horizon meets the rugged moors.
Where city streets meet crashing waves.
Life feels bigger in Plymouth.
New adventures have always started here, and it's time again.
From marine science and autonomy, healthcare, creative innovation, manufacturing and defence, we're charting the nation's future.
We are the city with the warmth of a tight community.
Where creativity knows no bounds.
Where we go beyond.
Because we go together.
This is Plymouth's promise to you.
Life here will be an adventure.
Make life an adventure.
Okay, that's it from me, thank you. The film is available if you want to use it, and you might have seen last week with the City of Culture announcement, it can be cut into, you know, if you want to cut it and use it. We also have lots of what we call B-roll, which is other footage which we're about to start to shape into sound bites specifically connected into different sectors or different areas and different communities. So over the next 12 months we'll be starting to share those. But that's it from me. Thank you for now, Mary.
Thank you, Amanda. Any questions for Amanda? Patrick?
Not so much a question, Mary, but comment. And thank you very much indeed, Amanda. I've not heard the presentation before, and I thought it very, very uplifting. It's a situation as a Plymothian that we've had really for all of my life, where effectively there are people in the Southwest Peninsula that do Plymouth down, and it's very, very important that we do, all of us, from a Plymouth perspective, sell Plymouth's positivity and the positives of the city. So I suppose the question really is how, notwithstanding that we're all ambassadors and we all need to promote, you know, the cause of Plymouth, what's the plan to try and, you know, there are organisations like the university and others who will use this material to recruit and to draw people to Plymouth, but what's the City Council doing to try and purvey this good work and all the positives to sort of wider parts of England and Wales and Scotland to draw people to Plymouth and to educate them about Plymouth? And it's staggering how ignorant people can be about their own country and about a place like Plymouth. I did note in COVID, when a lot of people had to holiday in the United Kingdom, that there were people coming to Plymouth who had never been to Plymouth and, you know, spoke to people on the hoe, and they were just enlightened by what they saw when they got to Plymouth. But actually getting to Plymouth, a lot of people would never make the effort. So just an open question of, you know, what are we doing also to those communities far and wide that we want to try and educate to come to Plymouth and to benefit from all the good things that happen here?
Yeah, no, that's a really good question. Thank you. We're doing a number of different things. So yes, we are encouraging all partners to use the narratives and the visuals, and because of course many organisations have got tentacles that reach out across the whole of the UK and indeed globally. We're working with Team Plymouth to look at opportunities particularly linked into the defence growth deal, and with some thinking around what we're terming as a talent attraction accelerator at the moment, which is, you know, how do we compete with the likes of, you know, Barrow and some of the other defence clusters across the UK. So there's a national defence campaign to get people into defence jobs, but actually that's not saying come to Plymouth, that's saying get a job in defence. So there's discussions around that, and we're exploring the opportunity to potentially lever in some funding through that. You know, obviously that's a little way off. It's likely to be later in the year. We do need to also explore other funding opportunities as they come into the city, so things like the Towns deal, because there is no doubt we need some funding and some resource into the system to make a step change, because if we don't do that, we won't make a difference, you know, if we keep ticking on as we are. So there's a lot of activity looking at that, and you know, over the next 6 to 12 months, that'll be a crucial thing. We'll be getting some resource into that system.
Could I just ask one supplementary? Clearly, with local government organisation, we're having a lot of discussion, obviously, with wider Devon, and David chaired a very good meeting just on our doorstep in Sparkle a number of months ago. And we have our biggest critics are those that live on our doorstep. So, you know, people in Cornwall, probably many of them never come to Plymouth. People in Southampton are selective, you know, they'll come to our theatre because they want to go to a decent show, but they're not willing to give any credit to Plymouth for having a theatre or existing. So is there an opportunity in local government organisation future discussions, again, to sell to our neighbours the benefits of Plymouth, not so much for employment, but for all the wider aspects of culture, retail, you know, and other aspects of city life that many of them, again, don't really know what's here. And it's another opportunity of actually talking us up.
What I'm going to do is ask Jemima to take that as one of the protagonists for getting this up and sorted. So if could you turn your mic off there, Amanda, please? Thank you. Do you want to say how?
Well, what I wanted to say was, I think it's really important to say that this is a whole city initiative, and certainly the Plymouth City Council has got a role to play in disseminating it. And I'm really, really glad to hear you talk about it positively, Patrick, because I think it's incumbent on all of us to kind of promote this work. It's been 2 years. What Amanda's done, you know, anything that involves lots of different people and lots of different organisations is, you know, notoriously hard to manage. But actually, this has been a really positive process, and we've had partners from right across the city who've been involved and who funded this work because they acknowledge the importance of raising our profile. And I think you're right, Patrick. I think some of our worst critics are actually people in Plymouth and just in the surrounding area who, for some reason, have an entrenched view. It doesn't matter what evidence is put in front of them. And as you say, you know, I went to some of the LGR meetings where people talked about, oh, well, I never come to Plymouth. And I would say, oh, so you don't go to this? Well, of course I go to the theatre. You don't go to the box? Well, of course I go to the box. And just sort of manage in their head to kind of segment their view of Plymouth. And so I think this can only be a really, really positive step in getting people to really acknowledge what Plymouth has to offer. And I mean, every time I watch that film, I feel inspired, and I think it's easy for people who've. I mean, I've lived here a long time. I didn't grow up here, but sometimes I think we're all guilty of kind of forgetting what's right in front of us because we see it every day. We live with it every day. And I just share one story. We had somebody who came down to work with us a few years ago, and I drove her around the Hoe. She'd never been to the Hoe before, and we rounded the corner where you come to Smeaton's Town. It was a beautiful sunny day, I have to say, and I wish that we could fix that. But she said it was involuntary wow. And I've always remember that because I think, well, I go drive around here most days, and I think it's lovely. But actually, it was a wow from her. So I think it's something that we all need to be positive about. It feels sometimes that we are surrounded by negativity, but actually this work and this film and the branding stuff that goes around it really underlines what we've got to offer. And it's been brilliant to see. And it was only Monday we announced City of Culture. I think it's been a long week, Amanda, to see all that branding translating into that project, and it really works, and it gives a really good example of how organisations can use the brand assets and the narratives and the proof points and all that work to feed into what they need to do to attract people to their place. And I think there's also, if you don't mind, one last point around pride in Plymouth for us as Plymouthians and Janners. Definitely there's a big talent attraction piece that we need to do, but actually I think this can really help people in the city appreciate what we've got And yes, we've talked about challenges and difficult things in the city today and what we're trying to do to address those. But this really highlights, I think, how lucky we are to live here, and sharing that with the wider world is something that we all need to do, because I think now is our time to really put Plymouth on the map, and this work is going to really help us do that.
Thank you. I'm going to go to Neil now, because you're the newest addition to Plymouth's citizens. How did you wouldn't have seen something like that before you got here, but is it something that you think can inspire some staff recruitment from the health service?
So so I've spent three months in Plymouth, and I would describe it as endearingly self-deprecating in terms of its kind of confidence, which actually is reflected, I think, it's certainly reflected in the hospital and the people who work there, and we are clearly the biggest local employer, so we are very representative of the community. And I, so how do I say this? I had a very home counties view of Plymouth, which was basically dockyard deprivation and somewhere where tourists went to cinema when it rained. And I was very pleased to find out that is not the case in terms of some of the development. I've had a very expert talk from Gary around the city, and the size of the growth that's coming in is fabulous. The city centre development and the housing, etc., is fabulous. I mean, I had this interesting conversation with some consultants in the hospital, in that our adverts for new consultant posts just have a picture of a beach. And if you go into the British Medical Journal vacancy section, every single coastal city that's recruiting consultants has a photo of a beach next to it. Therefore, my challenge then was, what are we doing to distinguish ourselves from another kind of coastal community that's trying to recruit people? And in terms of the life science research you can do here, educational facilities, certainly the lifestyle kind of choices, there's more than we can do to sort of try and connect this across the various partners of the city, because obviously people often come with their spouses and kids, and promoting education and all this stuff is really important. So it's really important. This piece of work is really important to me, because we do find it hard in some areas to recruit certain specialists coming through. So I've already emailed people in my organisation to invite Amanda to come along to talk to us about it in terms of how we kind of connect it also.
Excellent, that'd be useful.
I remember my first visit to Plymouth was a bit grim.
You need to use your mic.
Apologies. I moved over from actually Ashford in Kent, and I'm not from there originally, you can probably tell, but yes, it was a pretty grim, wet February when I first came to the city, and I said to my husband, "Do you really want me to come and live here?" And I think sadly that that happens a lot. So this is about dispelling the myth a little bit, really.
And just a very small practical personal reflection. So you can get into the city basically two ways. You can drive in from the east, or you can get the train in. You drive in and actually you come on the A38, as long as it's not raining. You get the Ocean City sign, and you can suddenly sort of see the skyline in terms of and then you see it's actually for someone coming in new, it's like, oh, this is kind of an interesting bit to come in. I actually came in first by train, and you come out of the station. That's not quite the same experience.
Thank you. Any other question, Laura?
If you're interested in reflections, I'm afraid I'm sat here as someone who doesn't live here. So I travel down from Somerset to work. And what resonated for me in the presentation was this feeling that around the need for an ecosystem. So if you want to commit to living down here, to know that there's career progression, not just one job, but what's the next job and the next job, and what's the challenge of the environment, and to know that that story is being articulated, that there's a narrative around the ecosystem, the 500 years of innovation. That's quite thrilling. And the last year for Plymouth has changed my perspective on what my future could look like down here. Because where I sit, and this is about the distance, where I sit geographically, I have access to Bristol, Birmingham, London and Exeter. So how compelling is Plymouth? And actually, with the amount of investment into the city and the complexity of making that investment real and inclusive, there's a huge opportunity. The optimism is something I think I see captured in the work that's just been shared, and that's truly exciting. So yeah, just to say, I'm a non-Plymouth resident who's perhaps thinking that now's the time.
Cool. Great stuff. Jamari, you wanted to ask a question, and I don't know whether that was subsumed in.
I didn't actually, but I
Oh,
was
right.
going to say one last thing in terms of this being in the Health and Wellbeing Board. I think there's a real compelling argument that if you feel proud of the place you live, that's going to be good for you and that's going to contribute to your well-being. And you're not the first person I've heard who said in the last year or so, I never thought of Plymouth. As somebody I have had dealings with who grew up in Plymouth, felt she had to leave Plymouth to progress her career, and she works in a creative sphere. And now she is seriously thinking about coming back to Plymouth and bringing her family back to Plymouth because she thinks it's a place where they can all thrive. So it's not, that's anecdotal, of course it is, but I think that kind of level of pride and ambition is beginning to hit home with people outside of the city, and that's what we all need to keep pushing.
Just thinking about, we've got council in a couple of weeks' time, haven't we? I'm just wondering whether or not we could have that little film go through at some time, because not all councillors would have seen this, and it shouldn't just be kept to the cabinet and to a few others. I think we need to think about how do we share that. So we wouldn't ask you to speak to it, probably, Amanda, but it might be something useful. Yeah, Karen.
It's just a really quick question to Amanda. Obviously, there's going to be substantial redevelopment in the city. I know that one of the reasons people would prefer to have gone to Exeter, can't even get the word out, for Christmas shopping as opposed to here this year was because of all of the roadworks and the redevelopment and all that kind of thing. I appreciate it's going to have to happen. Is there like a plan within Plymouth's branding and its strategy to be able to think about what is likely to happen with all of that in the next 10 years in terms of attracting people to a city that's probably going to be a little bit of a work in progress for a while?
I'm going to ask Jemima to take that rather than Amanda, all right?
There's a report out today actually to say that footfall in the city centre is up 6%, which compared to a national average of 1.8% is really significant. So actually it hasn't put people off, and I think part of that is the city centre company have been incredibly ambitious about the events and the entertainment that they put on in the city centre, and that's really paid off, and people have really have actually come into the city centre. So they seem to be bearing with us around the unfortunate but necessary disruption that is really going to make our city centre so much more improved. So I don't know if Amanda wants to come in back. I want to just counter that, because actually the stats don't say that people are staying away. They're actually coming here more than they're coming to other places. I don't know how it compares to Exeter, but the national average is 1.8%. The footfall is up, we're 6%. That's definitely something to be celebrated.
Yeah, I will add to that. So we've got something called the Data Hub, which Jemima is aware of, which is uses BT footfall analytics to look at people coming into the city centre. So it's a broader footprint than the city centre's footfall counters. So it looks at the waterfront, and it also looks at Royal William Yard and sorry, apologies. And we actually look at the Life Centre area as well. And that's shown that we're up year on year. That's against a backdrop of just for the visitor economy, we are down year on year for the broader visitor economy, but we're nowhere near down as much as Devon and Cornwall. So, Cornwall's looking like it was about 10% down year on year last year. So coming back to your point about visitors from Devon and Cornwall, we do attract them in as day visitors, and if those numbers are down, then that will affect us as well. So we have every reason to engage as much as possible with our colleagues in Devon and Cornwall to make sure that we're all benefiting from the investments and the impacts that are coming into the city.
I think just come in on Karen's point, because, as an observation, I think it's a fair one, that we always need to take cognizance of impacts of development or roadworks and those matters. And I use an example. I think it was for the when we had the firework display in August, I think at the same time we were resurfacing the pavement or taking up the pavement slabs in Exeter Street to put tarmac down, and we closed the lanes. And even though no work was happening in the evening, there was lane restrictions in Exeter Street, which was unfortunate because you got thousands of people leaving the Hoe from the firework display. So I think ultimately the point that Karen made is something that does need to be weaved in underneath the strategy to make sure that we minimise impact, because you only need somebody to come to Plymouth once, have a bad experience, they won't come back again. And there can be some very practical observations that can actually make life easy. And I represent Plimpton. Marshmallows roundabouts had South West Water in the run up to Christmas for 2 weeks doing a manhole cover. It's pathetic. It really is pathetic. And so I would just hope that beneath this strategy, some of the practicalities of keeping our city moving and keeping it attractive, we do take on board.
And certainly a lot of the things that are going on in the civic city centre at the moment will be finished by Christmas this coming year. So hopefully we'll get an even better footfall to the Christmas market, etc. Thank you, Karen. Thank you very much, Amanda, for coming along this morning. As I say, I've put that one recommendation that we show this film a little bit more. But following this adoption by the Plymouth City Council's Cabinet in October 25, that Plymouth Health and Wellbeing Board, 1, aligns with the citywide brand strategy and new narratives to position Plymouth as a place to live, work and study and visit. Secondly, aligns with key components of the city branding work, including narratives and visuals, and mainstreams them. And I think there's, where mainstreams them was appropriate, to key delivery programmes and where the city-wide messaging is required. Thirdly, recognises Destination Plymouth has a broader remit as a citywide marketing organisation with strategic responsibilities for leading the brand strategy and implementation, positioning the city's place, brand, going forward, as well as continuing to drive the visitor plan. And last there, recognises the support of key city partners in funding and driving this work forward, which to me is really great that they've all signed in for that. So were you all happy with those 4 recommendations, plus the other little bit that we put on? Okay, Amanda, thank you very much. Right, Ed, you've been patiently sitting there, and so now we've got your presentation, please.
Thanks very much. It's just a really brief update today to Health and Wellbeing Board. Obviously, Chris has asked me to attend for him today. It's just providing a verbal update in relation to the neighbourhood health plans. In terms of just making the Health and Wellbeing Board aware that there will be a forthcoming ask to support a neighbourhood health plan. So late last year, NHS England published the operational planning guidance as part of the annual planning process for ICBs and NHS trusts. And as part of the guidance, there was a requirement for submissions, and the indication was given that we need to produce and submit a neighbourhood health plan. So the neighbourhood health plan should set out how the NHS, local authority and other organisations, including social care providers and the voluntary sector, will work together to design and deliver neighbourhood health services. The Department of Health and Social Care are yet to publish any guidance on that, so we're still awaiting what the guidance looks like in terms of developing the neighbourhood health plan. We're expecting this imminently, but as I say, at the moment we haven't got the information we need to work to, so it was making sure that you're aware today that there's likely to be an ask, and we'll need to make sure that we can work how we come up with an approach to manage that moving forward. So I think it's important to note that the Plymouth Health and Wellbeing Board was also recently successful in a bid to receive the enhanced support, which was commissioned by the Better Care Fund national team, to support us in the development of the developing our national health plans whilst we await the guidance, following a successful bid just before Christmas. So thanks to Elliot for pulling together and drafting that at such short notice. We're also obviously waiting a contact from the BCF to explain next steps. The latest update on that is I've got a call at 1 o'clock today to understand a bit more about that. So I'm hoping that's going to give us some of the detail that we're awaiting. I think it's really important to note that the ICB and Plymouth City Council are going to work jointly to develop this, but we're keen to ensure the Health and Wellbeing Board is both engaged in its development and supported through the sign-off process. And as soon as guidance is published, we will share this with you to ensure we are agreeing a plan as to how we can move this forwards. But anticipate this to be published to enable us to support this through the March Health and Wellbeing Board. Obviously, there's been a lot of work to date in terms of a lot of national work and local work around national neighbourhood health and integrated neighbourhood teams, which are the sort of the new buzzwords and areas of focus and priorities for us all moving forward. So I think it's important to recognise that the work that we need to drive forward we done through the local care partnership, and there was a meeting just before Christmas back in December where there was a commitment to continue our collaborative approach across health and local authority, and one of the actions taken away from that meeting in December was to map out all the work and come up with a strategy as to how we can develop a single programme and associated governance infrastructure to drive forward neighbourhood health moving forward. I think it's obviously from a local authority perspective and a health perspective, it's really important that we drive through forward the work around neighbourhood health and integrated neighbourhood teams collaboratively together. So there was a commitment from the CEOs, and I know Gary's got an action to take some of that work forward between health and the local authority over the coming weeks. And obviously I think it's important to note as well that and recognise that to date, since back in the summer, we put forward an application to be part of the National Health Neighbourhood Health Implementation Programme, which we weren't successful in, but actually it stimulated an awful lot of excitement and engagement around how we develop and co-produce and work together in a collaborative way with all partners across health, social care and the voluntary community sector, and engage in our communities to understand how we can better deliver services for our neighbourhoods in a more joined up way. So there's been a number of ongoing workshops that have taken place to date, which will continue, which will then link back to the local care partnership priorities and delivery, and then obviously back to yourself from a Health and Wellbeing Board perspective. So that was just a brief update from me on that, but happy to take any questions.
Thank you very much. And I suppose, Gary, from thinking about the neighbourhoods, we're going to have to think about LGR and how that will influence some of those, even if it's just, you know, sort of on the back of a file packet or something like that. We need to think about that because that will also impact, won't it? Sort of either yay or nay, regardless, I suppose, we need to be absolutely sure. And I think what we also need to be conscious of that if the Health and Wellbeing Board need to go along with what needs and giving their opinion, that I would say that if we have to call an extra meeting for that to meet in with the timescales, it's something, extra meetings aren't always great, but on the other hand, I just don't want us to miss any timelines. So just be aware of that. We will call you if needs be. And Tony, I'm going to ask you to come in here. I mean, are you picking anything up through Health Watch about all of this? Are people excited?
No, and probably no. I guess the challenge is here, and I think the move to a neighbourhood system that supports long-term conditions or diagnostics from a health point of view, and then those low-level health and wellbeing services that we've currently got in the wellbeing hubs is probably the right move. But it's how people understand that change, and I don't think anything that's come out either nationally or locally is raising the interest of individuals, I would say, at the moment, which leads to one of the concerns of how are local people going to get involved in this to give a view to help shape how we deliver those services. And I guess the other concern that I see at the moment is, do we really understand what we're currently delivering and where that's being delivered so that we don't end up with duplication? I think duplication and a postcode lottery are particular dangers within this if it's not co-produced and understood correctly. And I would hope Rob would probably agree with some of that from a voluntary sector of how they get involved within this. I think there's obviously, you've got to have your first meetings and agree from provider and commissioners what potentially how you're going to work together and what that looks like. But what's not clear to me either from a national or local level is how that then moves into that public arena, and we involve people, which the 10-year plan says that people should be at the centre of that.
Thank you. That's really helpful. It's something there we can make sure that everything is tied up there, can't we? Anybody else want to make any comments about this? Gary?
I feel I should make a little bit of a comment about this. And I guess for me, there are a couple of things. Firstly, we should appreciate the good position in many areas that Plymouth is in terms of things it already does in communities, with communities. And we need to make sure of that. Accepting your point, we need to make sure we really show that into the process that talks about neighbourhoods. And broadly, we have to, I think, really welcome the direction of neighbourhoods and the work happening through our health services with us to look at that. It's that real opportunity, isn't it, to say we understand our communities, we know what they need, and this is how we want to shape and deliver services for them in the future around both the prevention agenda and keeping people well, helping them manage their conditions. So I think it is really exciting. It would be nice to have the guidance there, wouldn't it? Which I think is the thing which will help all the storming of ideas, of which there are plenty at the moment around, will help put that into some shape. And I hope you mentioned the LCP and those other places, those being really quite important vehicles to help coalesce that into a single strategic direction really for our city. You mentioned, Mary, the need to call the group together. I think that's a really important principle for us to agree. Some of the ambitions and the pace people will want to go at in some of this may require that, and I think that's a really helpful call out for it. But I think it's a helpful update, but there'll need to be more formal discussion both here and through the LCP to help drive it. This is one of the key ways we're going to make sure services both meet people's needs, but do it in ways that are really effective and efficient for us in terms of that prevention agenda as well.
Thank you, Gary. Anybody else? No. Karen?
Can I just clarify the timescale? Because I think the NHS have put some times on this, haven't they?
Yeah, absolutely. So obviously there's some local timescales that we need to deliver to Karen, but obviously there's also we're waiting the updates in terms of the guidance from the national team. As I said, I think I said the neighbourhood health plan and how this links back to the Health and Wellbeing Board will be predominantly guided through the Better Care Fund planning moving forward. So that will all link into some of the planning for 26, 27 and what the opportunities are, given that we jointly govern the BCF through the Health and Wellbeing Board. We'll obviously need to work really closely once we've got that guidance. So I'm anticipating that to be fairly soon, but do recognise that we need to ensure we do this. Sometimes you need to go slow to go fast, don't we, with some of the development with this, and we need to make sure we don't end up with duplication. So it's really keen that we involve all partners, but as you point, Tony, in terms of that community involvement and co-production is really key in making this a success.
Thank you. Right. David?
Just from a children's social care national reform perspective, one of the work streams is also about how we deliver those children's services in a locality. So as the work develops, we are wanting to work that through and in, as far as possible. So I just wanted to comment on that, and I've been involved in the discussions with Gary and LCP a couple of weeks ago. So just Ed, we haven't met before, I don't think, but just to put it on your radar that we've also got an expectation that our services are multidisciplinary, co-delivered, co-located. And when I'm talking about them, I'm talking about our social workers, our early health workers, our family support workers. So how we can achieve as much alignment, well, understanding that the drivers for the change are different, but out of those different drivers, could we get as much alignment as possible to make it make sense for the people of Plymouth?
Absolutely.
You want to come back?
Yeah, just on that point, I think there's also the bit of transition from children to adult services. particularly around neurodiversity and mental health, but other services as well, I think, and it's an opportunity to make that transition a lot smoother process.
Thanks. Rob, did you want to come in?
Yeah, I've been working closely with Ed around the whole proposition around integrated neighbourhood health, working closely with adult social care at present, working on city health prevention strategy, working with the family hubs, and all of the plans, the drive are all heading in the same direction. And ultimately, this is about how we implement person-centred, holistic, trauma-informed service redesign from the bottom up. And I'm really wary about top-down solutions and rolling out services in that way. I think we've got to roll in incrementally. It can be done at pace. It can be done at different rates of change in different areas of the city to reflect different neighbourhoods' needs. But we need to develop this from the bottom up. So I think there's methodology that we've particularly developed through the Changing Futures programme over the last 3 years about how we engage with local communities and particular cohorts of people to redesign services. So I think there's a tremendous opportunity here to get it right, but also a tremendous opportunity to get it wrong. So from a wellbeing hub perspective, from a wider voluntary sector perspective, I think that's the most important message we'll be getting across. And I know Ed completely understands that, but sometimes the system can develop a way of being and a sense of momentum all of its own, and that's what we've got to be really careful about checking, and that this isn't something that's rolled out top down. This needs to be bottom up redesigned, co-designed, co-produced with people, individual people at its heart, and that means challenging professional silos, professional protectionism across all of the different departments. We've got a lot of jobs and systems in the organisation that have been designed for the system, not to meet people's needs. So you can probably tell by some of my commentary here that I feel really passionate about this. This is a cultural change programme across the piece, and it's going to be very, very challenging. And there'll be blocks. There'll be blocks from middle management, from people with clinical professions, because it will challenge the orthodoxy. When we start having detailed, in-depth conversations with people and their needs and what they want, they're often different from what the system's offering or how it's trying to push them around the system and not meet needs. You know, we're great at failure demand, about how we push. You know, we manage the system for the system's purposes rather than meeting people's immediate needs, because we've got false metrics, false targets that we're looking to meet. So we've really got to break through that conditioning and that thinking in the system. So it's really hard to engage with and to understand. I think as a piece of system work, it's very abstract. People are still trying to understand what a neighbourhood means, what locality means. So it's going to be a bit of a roller coaster ride over the next few years. But if we maintain that perspective that this is about designing services from the bottom up around people's individual needs and breaking down those organisational and system silos, we've got a chance of making something truly impactful.
Thank you. Gary's listened to that, definitely, and we'll take note, and so will Ed. Thank you, team, very much indeed for that. Right, I'm now going to move us on to the revised terms of reference, and where it says here Steve and Elliot, presumably you can just leave it with Elliot now. So over to you, Elliot.
Thank you, Chair. Just a quick overview or recap for members that we had in the spring 2025, the development workshops came together as a board and discussed whether we think our current terms of reference and organisations fit for purpose. That report then came back to the board in April 2025, and the board agreed to a couple of things: consider widening their membership to include other providers to increase representation, mainly as well relating to the terms of reference, clarity between core and additional members, and what that meant for quorum and voting rights. Having reviewed the terms of reference, we've also included changes to partner organisation names, board membership role profiles, which is essentially updating names, but we've also added in a change, which is the inclusion of neighbourhood health guidance. All of those changes are set out in the report. I think the main one to draw your attention to as a fundamental change would be the change to quorum, which removes co-opted members. That for the reason being, if we add more co-opted members aren't mandated to attend every meeting, and therefore we could become inquorate. If the board, following amendments, approve these, they'll go to City Council in March for formal approval. Ruth, anything you want to add?
The only thing that Steve's asked me to mention is, as you'll all be aware, the health and wellbeing strategy is the Plymouth Plan, and the Plymouth Plan is currently in the process of being refreshed and renewed. And so what we'd like to ask is that a workshop could be set up towards the end of February for the Health and Wellbeing Board members to review some of the key points of the current Plymouth Plan as it relates to health and wellbeing, and suggest any changes to that. And to do that, we will also be providing the draft of the sort of state of the art in terms of health and wellbeing that we've mentioned previously as well. And I also believe that there's thinking around, from that exercise, we could highlight a set of priorities that we might want to focus on in the Health and Wellbeing Board meetings for the coming year. Thank you.
Any thoughts? You're all happy with that if we pull something together? So there's a recommendation from that the Health and Wellbeing Board review, comment and endorse the draft update terms of reference, and they go to the City Council for approval. Karen?
There's just noticed there's no mention of ILP in the members. That's probably an oversight, yeah? Improving lives, Plymouth?
Yeah, I believe it's encapsulated. We tried to do as broad categories as possible, so it would be encapsulated under VCE representatives. I will add on to the end of that to specify each individual ones. The same goes there for University of Plymouth. Unfortunately, we scrubbed you off and we've put academic representatives, the aim being to include wider partnership amongst the city. So yes, thank you, Karen.
Thank you, Chair. You partially answered that question, Elliot. My question I was about to ask about the definition of academic, what was it? What do you call them? Academic. Is that an open class? Does it mean that presumably it covers all the universities of the city, the College of Further Education, but also would it be open to other institutions as well?
Through you, Chair. Thank you for the question. Yes, the intention is to widen it to as many relevant representatives as possible. That wouldn't mean that it's an open invite for anyone to turn up, but it would be for the board to then, within that category, go, I believe on this occasion, this organisation or person has the relevant experience to come in on that matter. That makes sense.
Not strictly a supplementary question, but an additional question. When you changed the statutory definition at the beginning, why is that done? Because the Act, the 2012 Act, is already in place. Why is the definition statutory now used? Is it simply for the core membership and the co-opted members, and using that as a differential? Presumably that's the reason.
Yeah, thank you. Members before were unclear as to the previous wording of additional and what that actually meant for voting rights or for quorum attendance. So I've just put statutory as was set out in the Act, so it was defined by government as must include those people, and then co-opted are the lists that the board have decided to expand to.
2012 Act?
Yes.
Right, folks, everybody's happy now, they know what they're doing. Right, great stuff. Decisions tracking, have we got any? Oh, so you're happy with that? I did say that beforehand, so you're happy, right? Okay.
Thank you, Chair. Tracking decisions, there's not many updates to provide you in terms of the first one on your list. I'm going to suggest later on that we have a vaccination update at our next meeting. And those 3 requests there will be brought back as part of that report. On the second one, there was request for clarification on how young people would be consulted through the development of the neighbourhood plans. I've sent that to Chris, and unfortunately Chris isn't here to join us today. But I'm sure once that guidance is released, as Ed was talking about, we will be able to progress that one. There's one more on the back, which is going to sit with us for a little while, and that was an update for the implications on the comprehensive spending review. So once, I believe that's Gary, that'll be with you. I'll pick up with you to bring that one back either at our development workshop or afterwards. I'll take any questions. Thank you.
Thank you. Right, that brings us on to item 12, which is the agenda or the work programme. And in fact, the 12th of March is completely blank. So,
Through you, Chair, if I may get a quick word in. Following on from that terms of reference item where we've agreed to sort of provisionally schedule a workshop in February, that would be to sort of draft up some provisional aims and core priorities for the board. So there's a few items we can run through, but I would suggest leaving the sort of fundamental decision on that until the February meeting, because it might be that we decide to go in one direction or another based on the priorities we identify.
that seems very logical. And we like logic, don't we? Okay, so we'll accept that. Anybody got anything they want to talk about before we close this meeting? Right, Rob?
Hi, thanks, Mary. No, it's just a query about members, because YMCA was listed on there. And I don't know whether that was an error or whether that was...
Through you, Chair, it is listed on there. From memory, that was a suggestion from one of our workshops to include them. It's very much why we brought this today, essentially, is to say we've got VCSE representatives sort of listed there. We welcome your thoughts on who else is relevant and if any of them need to be amended.
Yeah, I mean, it's not. It's I don't know. It's really difficult. I'm struggling to see. I mean, they're a Wellbeing Hub member already. Other YMCA. So there may be other voluntary sector organisations that we could consider to add if you're wanting wider representation.
Chair, can I suggest that we talk about that at the workshop?
Agree, yes. We could have that workshop and then rethink the co-opted members there. I think that might be useful, or add or take away as needs be. Yeah, all right, you happy with that? Right. Okay, Rob, we'll make sure that you come to that meeting and put your point there. Oh, that'd be great. Okay, any more for any more? Or can I say thank you all very much for coming this morning. I think we've had quite a productive morning, really. We've made our feelings known about various things. So, you can go and get a coffee over lunch now. Thanks, folks, for coming. And we'll see you in the end of February. We'll sort out a date and let you all know as soon as possible. Okay? Thank you.